Questions or comments from the audience? This is a rare opportunity to get these folks together and willing. And Bill is particularly eager for solutions since he's probably going to be seeing a lot of questions in the next year or two. I think, have you all answered everything? That's, no public policy issues here, are there, Rick? Sue?
Here's a microphone.
Oh, thank you. My question is, the problems are very overwhelming. A lot of people need to be involved, but looking around this room as us as individuals, what can we do? What could we do as individuals to further the course towards repair or improvement?
Thank you.
I would say first and foremost, be politically involved. I think that we all understand the economic times that are going on right now, and we know there's no quick solutions to some of these issues. And you can't ask a city, for instance, to increase funding when their budget, they're not meeting their budget. But over time, we have to have mechanisms to do that. I don't know if you remember, but at one point in time there was a referendum or a piece of legislation that went through the legislature to allow us to determine whether or not we wanted to have the ability to have an ad valorem tax or something to address these kinds of issues for funding. That passed unanimously in the House and the Senate and was vetoed by Governor Christ. So that could come back up again. If that comes back up again at some time in the future, then it's going to take a lot of people pulling in that direction for that to ever reach that kind of crescendo again. The other thing that I would say is just help with sitting around with us and coming up with some of the solutions for how we can take care of these patients in the lowest cost setting possible. I think the solution is that we have to turn the pyramid, the current pyramid, which is we wait till people get deathly sick and bring them into the hospital and then we spend lots of money. We have to turn it upside down. And we have to get into prevention. We have to get out into the communities. We have to do this in the lowest cost setting possible. We have to do it after hours. We have to do it on Saturdays when people who work 2 jobs and have to wait for the other spouse, or there may not even be another spouse. They may have to bring their kids with them. We have to create ways for that to take place.
Because we're so focused, we didn't have an opportunity to mention that Sue Nussbaum, for example, is chair of We Care. Jim Burt's here, who's chair of Volunteers in Medicine. We have the former president of the Sulzbacher Center. All of these are safety net institutions as well and work in concert with these institutions, very, very collaborative in the community.
Sue, I'd echo that comment on political involvement. The Health Care Act has passed. It is law. It's going to be here, but it's far from perfect. There's going to have to be a lot of work done to get it better as we go forward. That's going to require everybody being involved. I think the fundamental issue right now is that we get what we pay for. We're paying for taking care of people who are sick. We don't pay to keep them well. That's going to be a huge change that has to take place in this country, and that's going to take each and every one of us being politically involved to make it happen.
Henry Luke, did you have?
I want to just introduce an unpleasant fact. We peaked in jobs in this region in May 2007, and depending on what month it is, we're between 45 and 50,000 jobs down since then. This problem that we're talking about is made worse by the fact that we hadn't created any jobs in 5 years. Last year, ending in July, we created 1,800 jobs. That erases the deficit in 20 years. If we're going to solve this problem and have more money for the city to give to Shands, we've got to have jobs. So I want to applaud this gentleman that says, let's get the ball rolling on using healthcare to create jobs. Healthcare and education is the only... Go ahead. Healthcare and education is the only job sector since May 2007 that has a positive contributor to jobs. Construction is down 50%. It's not coming back anytime soon. We can't keep waiting on it. Healthcare is the way to go. Thank you for bringing all that up.
Thank you. Bob Harmon.
Bob Harmon, Duval County Health Department. Speaking of jobs, could the panel comment on their electronic health record projects and health information exchange and how that relates to their future plans as we go forward?
Well, I'll start this off, and I'm really speaking for both Dr. Wilson and myself. Our board has allowed us to expend a significant amount of money, well over $30 million over the next 5 years for the hospital, as well as the practice plan has, what, about 10? About another $10 million on an electronic system called Epic. The Epic system, which it will soon be in about 40% of the hospitals in the country. They're a privately held company out of Wisconsin that's growing rapidly. We will have it in all the physicians' offices and all of the hospital locations, 100% of those, by the end of 2014. And so it's a painful thing to do, but we think that it will allow us to reduce redundancies in care where testing might be done in one place and then they don't have access to that, so they do it over again somewhere else. It will give them immediate access, so there'll be an immediacy and a speed that will occur with that, and it will allow us to track the patients very well throughout our system.
I would add that all the major facilities in this community are moving rapidly with electronic systems. Understand that the electronic systems are not exactly as great as everybody thinks yet. And they are not at the level of electronic systems in banking and other things. Much of that has been pushed back on front-end providers, nurses and doctors. So it's going to be a few more years before we see the ultimate benefit, but we will eventually. It will make care better and cheaper and safer.
I just wanted to mention one other thing that it came up in Dr. Wilson's slides, but it also came up in many of the conferences that we've had, the meetings of the group that we've had, and that's the graduate medical education, the residency slots in particular. The 320-something residency slots, as Dr. Wilson mentioned, there's only 273 of those that are funded. The shortfall in that up until now has been able to be covered by the SHANS part of the organization. That's $140,000 per resident all-in cost per year for each one of those. So for those 60, roughly, you can say that, we're covering that. So you do the math. And there's shortfalls in funding for Wolfson's, and Nemours probably has some residents working with them, and we certainly have residents working at Mayo, and we have a family practice residency at St. Vincent's, so I don't want to sound like this is a SHANS issue or University of Florida issue only. It is a community-wide issue again. But if we want to get our arms around something, trying to figure out how to go after the redistribution of these slots, that's a political activity again. There are places where residency slots really kind of go to waste simply because there's not enough. The formulas are archaic. They're old. They've been in place for a long time, and it makes no sense. I think we're 47th, maybe 47th in the number of residency slots we have per capita. It just makes no sense to me. So I think we have to get some political activity. And short of that, whether or not we can get a philanthropic type effort behind raising some kind of fund that would be utilized only for that purpose by all the hospitals and programs in the city.
David?
Everyone seems to agree that the shortage of physicians is one of the major problems in our healthcare near future. At one of these conferences and confirmed, about 50% of the graduates of the medical schools are women, and the professional career of a woman averages about 7 or 8 years. I've not seen this in writing, but if this is true, this is a great shortage of physicians, and I don't know how this is going to be addressed. There is no shortage of applicants to medical schools. My own school, Northwestern, has 7,000 applicants this year for a class of 150. So, but if half of those are women, and the professional average time for women is about 7 or 8 years, if that is correct, now I've not seen that in writing, that needs to have some...
I don't think that's accurate.
I don't agree either. I think that there's no difference between men and women in career length at this time.
If that's correct, that's the answer.
Please.
Hello, I'm Alice Weiss, a performance improvement specialist at Shands Jacksonville. First of all, I'd like to thank and give kudos to Mr. Burkhardt and Dr. Wilson for their many efforts and creative efforts to move us forward and keep us solvent at Shands Jacksonville. It was kind of nice to go ahead and list all the 10 or 15 things that Mr. Burkhardt described. My question really has to do with if we in this state choose not to expand Medicaid in conjunction with the Affordable Care Act, what's the discussion about what we'll do instead?
This is the discussion. Nobody's talking
Okay,
about
thanks.
I think, actually, it's a serious concern because whatever one thinks about it, the Supreme Court has made its ruling. Regardless of what the Supreme Court was going to do, I think there's going to be less money and more integration of services. But if we don't expand Medicaid, part of the federal law includes the elimination of disproportionate share payments to hospitals. So it could be perversely something that actually defunds hospitals like Shands even more than we currently are defunded, and that would be an extremely difficult hill to climb.
Tony?
I think that we've got a decision point in the road, and that is the election. And I'm certainly not going to get into the presidential election, but depending what happens there would depend on whether this debate remains a state debate or a federal debate. It could revert back up to D.C., and the options of the Medicaid expansions could be radically changed. So it's not necessarily a Tallahassee issue. I think if President Obama is reelected, I don't see the options to the states of choosing to fund Medicaid expansions changing at the federal level. And so it is an option. It will then become a Tallahassee debate. And I think that obviously there's some leaders who've taken some strong opposition against that expansion. I think the numbers are yet to be absorbed by our state and our community and our legislators. If those options remain available, we're talking about billions of dollars of federal money and thousands and thousands of jobs that we'd be turning down if we didn't accept that federal money. Now, I'm not here to say there isn't some downside to that too, but I think you're seeing the debate being delayed because people don't want to really elevate this war, this going to be very intense debate, until they know if it's a D.C. debate or a state debate. We know this: if it remains optional, there's going to be a lot of states who will immediately enact the expansion and take the federal money. It costs the state no money for the first 3 years to do it. So,
our time is short, so any final comments by the panel? As we heard from Pam Challey, health is our most important asset, and it's understandable that we citizens are concerned about it, and we are most grateful for all our institutions' efforts to work this out. Call on us, and certainly our other organizations like the Chamber and the Civic Council and our council are very eager to be of assistance in any way in this matter. Thank you very much.